So this rehabilitation is the single most effective intervention for promoting recovery after a brain injury. And however, the effectiveness of the rehab is influenced by the time elapsed between the acute event and beginning of the rehab. So within 72 hours, the brain starts an attempt to repair. Whenever there is a delayed rehabilitation, which is the main stimulus for the axon, any kind of neuronal plasticity, you lose an enormous opportunity.
So in neuro-rehabilitation, knowing when to wait is as important as knowing when to start, where each member contributes at different stages of recovery. The physiotherapist is required for the muscle, for the joints, occupational therapist for the activities of daily living, speech and language therapist for speech and swallowing. The nursing team is the backbone for any rehab hospital. So rehabilitation is a team effort. Recovery happens when expertise works together.
So that's it, that planning itself, formulation itself to treat, make him normal, after normalcy, complete recovery, then preventive things and reintegration, rehabilitation to society.
Critical illness often results in delirium, impaired memory and executive dysfunction. So untreated impairment guarantees poor functional outcomes. So reduced delirium duration and better memory recovery and higher functional independence if you give more importance to cognitive restoration.
Changing the emotion of the patient changes the biological activity. It changes in the neurons. Dopamine also, the receptors production changes. The apoptosis comes down. Emotional support, it's like an innate immunity. It helps in the recovery, and what we use in physiotherapy is just enhance that.
The only way of running, if a hospital wants to run out of hospital services, the only way of doing that is either to have an SBU or to have an efficient partner who can kind of take that responsibility, but it has to be a seamless transfer from the hospital outwards.